This session today it's about medical appointments, how to deal with medical appointments. It's about being an empowered patient. Empowered patients, people have always complained that they never get enough time with their doctors. They go in for an appointment, and it seems the doctor has one foot out the door. So I'm here to tell you that empowered patients, and I'm one of them, I get all the time I need. When I go to see my doctors, I get all the time I need. My doctors answer all my questions. And I'm going to, by the end of the session today, you will know how you can have that work for you too. First thing is to be able to prepare for when you know you have an upcoming medical appointment. You want to do some preparation. You don't want to just show up. They're personal growth opportunities, medical appointments. They're an opportunity for you to interact with your doctor as an equal partner. Your doctor is the expert on medicine, but you're the expert on yourself. So it's an opportunity to improve skill building and relationship building. So before each medical appointment, plan how you want to, what questions you want to ask. Make a list of the questions. I maintain a list all the time. I might not be seeing my doctor for another 6 months, and I start a list right then and there. Whenever I have a complaint, I put it on the list. So by the time I get in to see my doctor, I've got this list with me. So I'm very prepared. So before the appointment, have your list all organized. Plan how you want to ask organized, pertinent, and to-the-point questions. One reason people don't get enough time with their doctors is because they go in and they start talking about the weather or a vacation, and that's taking valuable time away. So when I go for an appointment, I focus everything on my complaints that I'm there to see the doctor about. One thing I recommend, if there's any chance that you're going to be receiving a serious diagnosis, a life-threatening diagnosis, or a debilitating diagnosis, you should bring someone with you, someone you feel comfortable with, someone you trust. A family member, a friend. Also, if you're having trouble tracking your appointments, if you go in to appointments, if you're someone who you go in for the appointment and after the appointment you can't remember anything, that's another reason to bring someone with you who can take notes. There's another possibility. If you don't have a family member or a friend who can go with you to appointments, there are advocates available. There are professional advocates. They not only will take the notes, they know how to help you formulate questions. They will help you organize your medical records. So that's still another possibility. If you're seeing a doctor and you keep going back to the same doctor and you're just not getting better, you should consider getting a second opinion. And you should always get the second opinion from a doctor who doesn't even know your doctor. You should get a second opinion, ideally, at another medical center. So, for example, if you get all your care at, let's say, California Pacific Medical Center, you might want to go to UCSF for the second opinion, or vice versa. Yeah.
Yeah. I have a question here, and actually I'm experiencing something along these lines right here. I'm a Kaiser patient, and I've been having a lot of pain in my knee. And I went last Wednesday of last week, I went to my primary care physician, and she openly admitted that she could see a slightly swollen area around the right side of my right knee. And I said, I haven't had any, relief from the pain here. And I'm already on, chronic pain medications. And I said, being on these chronic pain medications already has not stopped the pain in the knee. So she said, well, just continue icing it. And that was her solution.
Yeah, and so this is a perfect case where I would recommend getting a second opinion.
Yeah, and that's exactly what I was going to do. And I did contact another doctor there.
One problem with getting a second opinion at the same place is that the doctors probably know each other, and they're certainly going to stick up for each other.
Right.
So that's why it's good to go to another doctor who doesn't know the previous doctor. So something else I recommend before you go to an appointment, before every appointment, thoroughly review your lab reports plus your list of questions, as I mentioned before, and just any notes that you took following the last appointment or questions you've developed since the last appointment. Thoroughly review these before every appointment. And make a separate list that pertains to that specialist. So for example, if I'm on my way in to see my hematologist, I'm not going to bring my list with me about joint pain. Or if I'm on my way in to see my gastroenterologist, I'm not going to tell my gastroenterologist about my complaints about headache or backache. You know, I make separate lists for each that I have for each of my specialists. And, you know, I'm showing here on the slides electronic devices because that's what I use. But you can, paper isn't obsolete yet. It may be someday, but not yet. You may have questions about a potential treatment that you may have read about. And, you know, be sure to ask. You should also go into every appointment with a list of all your prescriptions. Now, if your primary care doctor probably has the list. But if you're seeing a specialist your primary care doctor doesn't know about, who prescribed something for you, you should make sure your primary care doctor knows not only about every prescription drug you're taking, but your primary care doctor and every specialist you see should also know about vitamins and herbs that you're taking. A lot of people don't know this, but herbs in particular can have profound effects. They can alter the effects of other drugs you're on.
You could have an allergic reaction. Well, my doctor warned me about getting the ones that have not been FDA approved. He said you could have just a serious allergic reaction to herbs that you never taken before.
That's right. It could be an allergic reaction. It could interfere with your immune system. It can interfere with, let's say you're on an anticoagulant. There are some herbs that interfere with that. Can make the bleeding time longer or shorter. So every doctor you're working with needs to know everything you're on. This may not be applicable for some of you, but I read medical newsletters and I read about new treatments, and sometimes I want my doctor to consider this treatment. So what I do is I come in and I hand the doctor a printed copy of the study that I read. You know, if I just say, oh, I read about something on the internet, they're not going to want to hear about it. But if I say, I read about it from Cochrane database, and here's the study, and you can read it at your leisure, then the doctor's more likely to pay attention to that. So the waiting room. So when you arrive for your appointment, I look around, I see most people in the waiting room reading magazines, texting, tweeting, watching the TV, in discussions. Because we all get so little time with our doctors, that the way I spend my time in the waiting room is I do slow diaphragmatic breathing to ground myself, to relax. And I review in my mind everything I want to talk about with the doctor. When you're in the appointment, during the appointment, while you're being examined, it's important to not think of yourself as just a helpless patient who has things done to him or her. You want to think of yourself in partnership with your doctor. You want to be collaborating with your doctor. When you go to a doctor for the first time, a doctor you've never worked with before, it's important to get a sense of how comfortable are you with this doctor. If you're really uncomfortable with this doctor, then you wouldn't, why continue with that doctor? You want to find someone else. Because it's really important you have a comfortable working relationship in order to get the best medical care. Every time I go in for an appointment, because I'm always bringing in questions, I always ask my doctor if I can audio record the session.
Are they usually okay with that?
Now, I've never been refused. Now, I've talked to a lot of people who have said, oh, yes, their doctor said, oh, I'd be uncomfortable with that. I don't want you recording. I've never had a doctor say it's not okay. They always tell me it's perfectly fine. And maybe it's the way I ask. I always preface it by saying, you know, I just don't trust my memory anymore. And I can't write fast anymore. So if I can record this, then when I go home, I can take notes. So what I do is I pull out my iPhone and I start the recording, and then I go into my notes app and I just use that the whole time while it's recording.
So let's say that you did this and the doctor refused. What would be your recourse then?
I would be very uncomfortable working with a doctor who's not comfortable with that. I would question him. I say, well, you know, it's important to me to be able to record it because I need to have notes. It's important for me to have good notes because I can't remember. And what is your hesitation? So I would have a dialogue.
Yeah.
But if the doctor is absolutely vehement, no, I never let people record and you can't do it.
Yeah.
Then I probably would not go back to that doctor because that's not someone I'm going to have a comfortable working relationship with. The point here, don't expect your doctor to have all the answers. There are people who go into their medical appointments and the doctor will start off by saying, so what's going on with you today? And the person will say, well, I don't know, you're the doctor, you figure it out. That doesn't help. It doesn't help the doctor, which means it doesn't help you. So as I mentioned before, medical appointments can be used as personal growth opportunities. So it's not just the doctor. But when I go in for a medical appointment, I make conversation with the receptionist, I make conversation with everyone at the front desk, the nurses, the nurse assistants, the techs, because then when you call up with a problem at any time later, they know you.
Allies.
What? Yeah, you have allies. Exactly. Yeah. You need allies.
Yeah.
And so I recommend, you know, making friends with everyone in the office. It doesn't mean getting together socially with them. It just means being friendly to them and you know, having a respectful interchange. Authentic self-expression is something that I've mentioned in the past is very important. It's been correlated with, in study after study, authentic self-expression is one of the attributes of the healthiest and happiest people in the world. People are able to express whatever's going on in their minds. So, as I say here, don't be afraid to ask questions when you are with your doctor. The only stupid questions are the questions you don't ask. You know, again, if you have a doctor who doesn't like you asking questions, then why would you want to be working with that doctor? And if you have any reservations about what the doctor is recommending in terms of invasive tests or treatments, then express your fears, your anxieties, whatever is on your mind, express that to the doctor and talk about it. And if your doctor says, well, I don't have time to talk about it, again, why would you want to be working with that doctor? There are plenty of doctors out there who are very comfortable talking about it. So another thing I recommend is when you go in to see your doctor, before you go in for the appointment, think about what you want rather than what you don't want. A lot of people tend to focus on, oh, my doctor doesn't listen, or my doctor doesn't give me enough time. And they're obsessing about this. And by the time they get in for the appointment, they have a negative attitude, and the doctor isn't all that comfortable being around the person. So before you go in for the appointment, put your attention on what you want and imagine getting it. Imagine getting what you want. Imagine getting your needs met. You're more likely to get your needs met that way. So, I've said this before, never do anything you don't want to do. Quite often doctors will recommend a certain treatment, or it might be a very invasive diagnostic test. You might be scared of the test. Ask questions. Now, this is where it really helps to know alternatives. In this previous slide, I mentioned a gastroenterologist once wanted to do an ERCP with me. It's endoscopic retrograde cholangiopancreatography. I didn't want it because it's an invasive test that can trigger pancreatitis. I just happen to know this, but I didn't say I don't want that test. What I said was, I said, instead of the ERCP, could I have an MRCP? And he said, sure. And that was the end of it. I got the MRCP. MRCP is not invasive. It's MR is magnetic resonance, MRI, but it's the same protocol. It images the pancreas. You may not know about all the other tests. You know, if you've been a nurse or something else, then you might. But even if you don't, just say, you know, I'm a little concerned about the invasive tests. What are the risks involved? It's important to trust your doctors because they are the experts. We are the experts on ourselves, but they're the experts on medicine. They are the ones who are experts on diagnosis and treatment. If you don't trust your doctor, either because your doctor doesn't have good communication skills, or because your doctor doesn't seem empathic, then find a doctor you do trust. Curiosity, I consider this very important too. You want to be interested. If you go into your appointments and you show no interest, like, you know, this is more common with men. Men sometimes will show up for a medical appointment and they'll say, and the doctor will say, why are you here today? And the guy will say, well, my wife made me come. Again, that's not useful to the doctor, and it certainly isn't going to help you as the patient. So it's important to have curiosity. Be curious about your condition. Be curious about how the doctor arrives at. So if the doctor orders a certain test, you can ask, well, why do you want this test? Don't be afraid to ask. Most doctors are pretty good at explaining things in lay terms. If you are seeing a doctor you like, but you haven't been getting better, now, there are 3 questions you can ask that before you go looking for a different doctor. If you like your doctor, there are 3 questions you can ask, and you might think this is kind of silly, but you'd be surprised. Doctors are just human beings, and like the rest of us, sometimes they just don't think of things, and patients can give them great ideas. So if you're afraid your doctor hasn't delved deeply enough, just ask. This is the first of the 3 questions. Ask this question: what else could it be? You know, you're talking about a certain symptom or cluster of symptoms, and the doctor has no clue. You can just ask, what else could it be? Here's the second of the 3 questions. Is there anything that doesn't fit? So the doctor's telling you, I think you have such and such. I think this is the diagnosis. And you can just ask, well, is there anything that doesn't fit? You'd be surprised how many times a doctor will go, well, now that you mention it, we could look at such and such. Let me test you for, let me write an order for this other test. And here's the third question. So sometimes, so in my case, I have several chronic illnesses I live with, and it's never been clear how these conditions are connected. But doctors typically look for one diagnosis to explain everything. So if that's the case, you could ask, is it possible I have more than one problem? And again, you'd be surprised. they'll talk to you. They'll engage you in conversation. So as I mentioned before, you want a respectful, mutually respectful relationship with your doctors. You want to feel like they're respecting you, and you want to treat them with respect. Whenever a doctor writes you a prescription, always ask, make sure the doctor is aware of all the meds you've been on. I had a primary care doctor at one time, actually this happened more than once, who wrote me a prescription for something. Now I happen to be a particularly savvy patient, and I immediately said, well, I can't take that because that will interfere with this other condition I have. And turns out that doctor, I hadn't seen that doctor for maybe only one other time, and she wasn't aware when I came in for my appointment, she hadn't looked in her records. So she didn't have it on the top of her head that I had this other condition. I happen to know that it would be dangerous for me to take the drug she just prescribed. Most people don't know that. So if you're not someone who's that savvy, and most people aren't, then I recommend always just simply asking the question, could this interfere with any of the other medications I'm on? And could this medication interfere with any of my conditions? So I've talked so far about what to do to prepare for the appointment, and then what to do during the appointment. Now I'm going to discuss what to do after. So you've now gone in for the appointment, you've left, and you've come back home. In between appointments, there's work for you to do if you really want to be a proactive patient. I recommend striving to live with self-determination. You are in charge. The doctor isn't in charge. You're in charge of your life. Live with intentionality, mindfulness. You're the only one who's responsible for your state of mind, and you're the only one who's responsible for whether you're going to comply with the doctor's recommendations. So take responsibility for your diet, your exercise, your sleep, stress management, relationships. Now I have relationships in here because, as I've mentioned in other weeks, social support is one of the things that, more than anything else, they've done studies where they've got people in the study who are eating all different diets, all different rates of exercise, but when they control for all those factors, the one factor that always correlates with better outcomes is social support. So, that's up to us to manage that, to make sure we have good social support, good social connections. Meaning and purpose, I've mentioned this before too. Have some reason to get out of bed every day, something you're looking forward to doing. Could be anything. It doesn't have to be earth-shattering. You don't have to change the world. It could be gardening, it could be meeting with a friend, but something you're looking forward to. You don't need to transcribe. I've said, in fact I say in the slide, transcribe the recording. So you've got the audio recording from the medical appointment. So I don't transcribe. I take the recording when I get home, and I sit here on my laptop, and I'm listening to the recording. I've got a headset on. I'm listening to the recording, and I'm just taking notes. But if you're not sure, if you're someone who's not sure what to take notes on, then it might be good to actually transcribe the whole thing, or hire someone to do it for you, or find someone you know who types really fast, and have them transcribe the whole appointment. That way you have those notes for the future. Anytime you're given a diagnosis, a new diagnosis, you should do as much research as possible. There are different ways to do it. Years ago, before the internet, I would go to the UCSF medical library. You can go to all academic medical centers around the world have excellent medical reference libraries, and you can find whatever you're looking for there. So the information is available, and if you don't if you're not comfortable searching the internet yourself, ask a grandchild to do it. They'll be able to do it easily. Just tell them what you're looking for and they'll find it. Also, my website is listed right here. I have a long list on my website of resources. So I've covered this before, knowing when to get a second opinion. If you don't like the specialist, you might have a very good relationship with your primary care doctor. But if your primary care doctor sends you to a specialist you don't like, go back to your primary care doctor and say, I'd like a referral to someone else. Now, increasingly now, the easiest way to communicate with your doctor in between appointments is through a patient portal. So I see doctors at UCSF, and they have a system called MyChart. So I go online, I go into MyChart, I put in my password, and I can then send a text to any of my specialists, and they usually get back to me really fast. It's way more efficient than trying to get a hold of them on the phone. They much prefer this system. I have doctors at California Pacific Medical Center, and they have a system called Follow My Health. It's the same thing. It's a patient portal. I go in there, I sign in, put my password in, I text my doctor, and they usually get back to me within a few hours. When you do this, though, it's very important to you don't start off by saying, "How are you today?" Every word is important. Your doctor is very busy. Think about it. Write the question first before you type it in, and get it as concise as possible. Just get right to the point. If you have any chronic condition, I'm one of tens of thousands of people out there who have found a lot of support at patient support associations. There are patient support associations for practically every chronic condition out there. There are patient support associations for cancer. There are different patient support associations for practically every type of cancer. The wonderful thing is you go to these places and you're going to get information you didn't have before. You're going to find out who the best doctors are. You'll interact with other patients who know from personal experience what you're going through, so you'll get emotional support. And even though I'm a very savvy patient and I do internet searches on PubMed and Cochrane Database, I have gotten information from patient support associations that I didn't have before. So I mentioned before, if your doctor isn't getting back to you what to do, so I said be a squeaky wheel. The squeaky wheel does get the oil. If you've had tests and you haven't gotten the results, contact the doctor's office and say, I haven't gotten the results yet. Never assume that the results are perfect just because you haven't heard back. You should always get the results. Even if you don't care about the actual lab values, you want to at least hear back from your doctor, how were the results? Were they good? Am I okay? So start by contacting the office. You could just call the office staff, or you could text your doctor through the portal system. When I do that, whether I'm texting or if you're someone who's more comfortable calling on the phone, before you make the call, make it easier for them in the office and for yourself. Provide them with the date when you had the test. If you know it, the name of the test, where the test was performed. That will make it easier for them to look it up. And have your medical record number handy so they don't have to look it up. I try to make it easy. Whenever I'm dealing with a medical office, I try to make it as easy for them as possible. It's just better for everyone. Unfortunately, there is a lot of malpractice out there. There are some incompetent doctors out there. And even when we see a very good doctor. The doctors are human, they make mistakes. I'm someone who, I've had the experience of falling through the cracks, where I went to a new primary care doctor one year, and the doctor looked at my lab values and said, there's something really off here. I'm going to send you back to the lab because they probably made a mistake. That was the right thing for the doctor to do. Repeat, that's the first thing they do. You repeat the lab tests. Now in this case, I went right back to the lab next door. The results came back, and when the results came back, I got a copy of the results, and they were still the same. So it wasn't a mistake. My lab values were way out of reference range. My doctor never contacted me. My doctor should have contacted me. He was the one who pointed out in the first place that my lab values were way out of reference range. And now I get he sends me back to the lab, still out of reference range. He never calls me. Similar things have happened with me with a number of doctors. And so when that happens, you need to be the squeaky wheel. Yeah.
Is that doctor that did fall through, was that doctor one that had seen you many times before?
No. Relatively
new?
It seems like the only times this has happened to me is when I'm seeing a doctor for the first time. This is another reason it's good to really establish a working relationship with your doctor. I had thought I was going to. The doctor I had been seeing got sick and couldn't practice anymore, and this was one of his associates in the office. So needless to say, I didn't go back to that doctor. I mentioned this before. In between appointments, keep adding to your list of questions. Just have the list somewhere. It can be a paper list, and just keep adding to it as the weeks and months go by. Just keep adding. Whenever you have a question for the doctor, just put it on the list, and that way, when you do go in, you've got the list. Now, this is something very few people do, but I do recommend it. One of the things I do is every time a set of tests are ordered, whether it's blood tests or radiological tests, scans, anything, when the doctor orders the test, I say, would you send me a copy of it? Now, sometimes they don't do that. No problem. I contact the office and I say, I had this test on such and such a date. This is the name of the test. Would you mail me a copy of it? And that's a way of getting your records free of charge. But if you're looking for all your back records, yeah, they're going to charge you for that, because then they have to go into medical records. But anyway, I recommend maintaining all your records. Yeah.
Well, I keep a file of all my lab tests.
Good.
I have a folder at home.
Great.
So I have it all there.
Good for you.
I don't have to pay for it.
That's great. Yeah. Yep. I do the same thing. I think it's really important. You know, it's important to actually practice feeling gratitude. And you'd be amazed when you do that before going in for the appointment. You will automatically be interacting with them in a way that they're going to really warm up to. They're going to appreciate you. And you'll get better treatment. You will get better treatment.
Larry.
Yeah.
I'm also with Kaiser, and I have a wonderful primary doctor. She's been great. You know, I've gone to her for several years. She's young, and if I have a question, I will call the office, and the advice nurse will give her the message. Within 3 hours, she calls me back.
That's my kind of doctor.
She's always
Great.
done that. Always.
Yeah.
So I have a good relationship
Yep.
with her.
I love the sounds of that. That's so wonderful.
She's
Yeah.
great. And after our appointment, I always ask her about her life.
Oh, see,
They're
this is it.
too. They have
Exactly.
life.
Yes, that's
I
right.
said, how are things with you?
Yeah.
What have you been doing?
Yep.
And we have a wonderful relationship.
Yeah, that's great. Yeah, I love hearing it. Yeah. I mean, it's good to do this everywhere. You know, if you go into a restaurant, I've observed, you know, there are these patrons in a restaurant, they go in and they're belligerent. It's not a lot of fun to wait on that person, so they don't get good service. Whereas there are other people who walk into the restaurant and they're talking to everyone. They're talking to the waitress and everyone. they get better service. And it's just more fun. There are a lot of apps out there, and there are new ones coming out all the time. I'll actually show you mine. So this is my iPhone, and because I am prone to go into atrial fib, I take my EKG. And so this is just a case, a different case that goes on the iPhone. There's a little EKG monitor in here. And you put your fingers on it. And when I put my fingers on there, it's actually, is the camera picking that up? It's actually taking my EKG. This is a real EKG. I went in to see my primary care doc right after I got this, and I showed it to him. And he kept exclaiming, "Wow, that's a real EKG." This tells me I can look at this. Well, you have to be able to read an EKG, but I can look at this and I can see that I have a P wave, which means I'm not in atrial fib. So, but even if you can't read your EKG, you can still have that one of these apps, and then you can send the results to your doctor, to your cardiologist. There are all kinds of apps. There are apps that check your blood sugar. There are apps that check your blood pressure. I have this list on my website. You can just go to my website.
Save the patient, I like that.
What did you say?
I like save the patient.
Save the patient. Is that one of them?
Yeah, the bottom.
Oh, save the patient. Yeah, that's funny. So much information is available now, right at your fingertips. This is a slide I've shown every week, just because I think it's so important. These are the attributes most strongly associated with people who do better than expected, people who just seem healthier, happier. Mindful curiosity, authentic self-expression, emotionally open and vulnerable. In other words, people who are very defensive are not as healthy. They live with more stress. Live with self-determination, be able to self-soothe, have self-acceptance, psychological flexibility, able to access your inner subjective experience, trust your doctors, be open-hearted towards others. I've talked about that. Be open-hearted towards others for yourself. Your heart will thank you. Live with meaning, purpose, and commitment to something. Have a reason to get up in the morning, and view difficult situations as a challenge rather than as a defeat. I mentioned that when I sit in the waiting room, I do slow diaphragmatic breathing. I actually do a particular type of slow diaphragmatic breathing called RSA, respiratory sinus arrhythmia. But anyway, let's just go through it for just a moment, just literally about no more than 30 seconds. Just tune into your breathing and allow yourself to breathe diaphragmatically if you can. So on the inhalation, the diaphragm goes down. And on the exhalation, the diaphragm moves back up. And as it does that, as you breathe and the diaphragm is going up and down, you're actually massaging your internal organs. This is the fastest way to calm yourself. If you're feeling anxious, anytime you're feeling anxious, if you just slow your breathing down and make your exhalation longer than your inhalation. So let's just also do like maybe 30 seconds of mindfulness. Mindfulness, just again, go into the breathing, but just tune into the physical sensations of breathing. And if your mind wanders, your mind will wander, just bring your attention back to the breathing. So we actually moved through the slides faster than I thought. This is the last slide. So, any questions?